Okay, so we want to thank again everybody for taking time and joining us tonight. We have two special guests with us from Island Health, Vancouver Island Health Authority. Let me start with Dr. Mike. Dr. Mike, I know that you are the lead physician for Island Health, as well as you have a huge passion for public health. That's what I find out. I also know that you were working in Toronto as well. Is that right? And public health as well. But you are from Alberta. Did I have that one right too?
Yeah, you've done your research. That's impressive.
Well,
yeah, been everywhere.
There we go. Well, that's good to have you here now in the island, servicing people like us, right? And would you say something about yourself that we might not know? I know your family, or how long have you been doing this job, and what is involved in that before we go to anything else? Would you able to say that?
Yeah, certainly. Happy to. First off, thanks so much for inviting Cole and I to come tonight.
Thank you.
I've been a physician now for 7 years.
Okay.
Is that right? Yeah, 7 years. And both a family physician and also a physician in public health. And the public health part is less, one-on-one treatment of people, but more organizing things for everyone to try to prevent disease and prevent people from having to go to the hospital. And so that's where my work right now comes in, with being one of the leads with the vaccine rollout. And yeah, for COVID-19, at the start of it, in the first wave, I was in Toronto, then ended up coming here, and I was lent over to the lower mainland for the second wave to Fraser Health, and been part of the island since.
Well, thank you. Thank you so much. We also have with us Cole Diplock, which is the regional manager of health protection and environmental services in the Vancouver Island. The title is quite long. Is this a lot of work on there? Is this what it is, Cole?
Yeah, that's exactly it. So essentially, I'm an environmental health officer, or a health inspector. You guys might have heard more of health inspectors. And so I oversee all of our health inspectors up and down the island. And so we've been working closely with the provincial health officer in understanding the orders and helping to enforce the orders, and trying to guide people, moving them through all these COVID restrictions and those kind of things, answer a lot of questions. So.
Oh, okay, perfect. And thanks so much. And you are, I know you're looking after the entire island, but are you located in Nanaimo or in Victoria? Because I saw some things about Nanaimo there.
Yeah, I'm personally located in Nanaimo. Yeah.
In Nanaimo, this is what you are.
I support all our offices up and down the island.
Okay, perfect. Well, you know what? Thank you so much for your service. It's very much appreciated, because of people like you putting your time, that we can count on being secure. We can count on having the right guidance in moments like this. So we want to thank you for that. That being said, tonight we also have Pastor Roger Esteves, who is representing the Sydney area church community, as well as the Souk area community from the church perspective. We also have Pastor Marian and Dr. Marian Kosovan, who represents the Victoria area, as well as the Duncan area church community, just so you know who is here in the panel. When we say that we have those two pastors, they've been here for I think about 5 years already in each area, servicing those areas, and they will be the one handle the Q&A for you. I'd like to introduce him as well. We got Scott Bastien with us. He represents our school, Lakeview Christian School, which has almost 100 students right now. And Scott has been doing this for about 2-3 years already, and he represents that community from the arm of each church here represented tonight. My name is Domingo Daniels. I was the one contacting your offices and soliciting that you were here with us tonight. So I want to thank you for accommodating us. I know how busy you can be, and to give us this time shows a lot about the passion and dedication that you have for this city.
I don't know if there's a more divisive topic in the recent past several months than vaccines. It seems like whenever the topic about vaccines, and especially vaccines in what relates to COVID-19, it seems like whenever there's a conversation about that, all the guns come out and we're ready to shoot at each other because, you know, half of the world supports vaccines, the other half does not support vaccines. And so I just want to ask all of us here tonight that we're not here trying to defend one position or trying to defend the other. We're here just to ask questions. And so, you know, we have a limited amount of time, so let's please keep it to one question per person. Pastor Marion or myself may ask a few more questions if they come up on the chat, if you want to put your question in the chat, or just to get the ball going. But please keep it to one question a person, so there's more people that can ask the questions that they may have. And you know, again, we're not trying to convince each other. We're just trying to listen from our experts, from our the ones that are responsible for you know, the health system here in the island. So yeah, so I'm probably going to open with a question, and I'm not sure which one of you wants to answer the question, but here's I consider myself fairly educated. I have 3 master's degrees. I'm working now on my doctorate degree. And yet when I Google this issue on COVID and the issue on vaccines, I get 50,000 websites saying that, yes, be careful with this because this is real, this is dangerous. And then I get 50 other thousand websites saying, no, it's all scam. It's, you know, it's the government trying to control us. It's a sham, you know. So I'm looking at those 2 websites and I'm or those 2 groups, and I'm like, okay, what do I do? I feel like I'm in the middle of this. So I guess my question, just to open the conversation, is COVID-19 real? Is it dangerous? Is there an issue to the healthcare, or is this just a big scam that you know, probably vaccines groups and other people are just bringing upon the world? Is this just a way to control the world population, reduce it? You know, just, is it real, COVID-19?
Yeah, I can start with that. I would say I appreciate how you started that off about how you were just here to have a conversation, and I'm here just to share what I know and what I've experienced. And I think it's a really interesting world we live in when it comes to like just information overload. I think like with COVID-19, it's always new information every day, and it's hard. You know, my job and Cole's job is to keep track of all that new information coming in, but it's an overload for us. And so I can imagine someone whose job it isn't to, you know, someone who has another job that isn't to try to keep track of everything that's going on with COVID-19 right now. How is it possible to keep track with everything, and, you know, to look at everything and try to decide what is you know, truth and what is fiction? And it's difficult to weed through that. And with COVID and with the pandemic and a lot of medicine and a lot of infectious diseases, there is a lot of unknown, especially when it's a new virus that comes about. It's like we are all learning together. And so I think it's uncomfortable to a lot of people, is to know that like we don't have all the answers. And I think it's very reasonable that sometimes a emptiness of where there's no answers, it gets filled with other answers. And sometimes those answers, they may not be true, but they can get pretty quickly spread about of this being truth. And so I think just overall, like, this isn't specific to COVID, it's everything that we have in our lives. It's that it's good to be skeptical of what we're hearing, about what we're saying, but it's also, I think, really good to be skeptical of where we're hearing that and where we're reading it from, and just to take a look at the resources and who's delivering the message. You know, I'm coming here as a guy who works for Island Health, which is kind of part of the government. So it's my first time meeting all of you, so I don't expect that people are going to instantly trust me. But and if anyone wants to, and I've been called any and all names under the sun, and so I'm not saying that anyone has to believe in me, but I'll just share with you my experiences so far about COVID-19. I was in Toronto, and we had the first case of COVID-19 that came into Canada. After that, we had pretty overwhelming surge of COVID-19 in long-term care homes there. Lots of deaths, lots of just chaos, to be honest, among staff, among people who lived there. And I can tell you that everyone there who was in that situation, they've seen COVID firsthand. They know it's real. It's been a bit night and day coming to the island because we've had a terrific experience with COVID-19. To look at the number of deaths that have been counted worldwide. What is it? I think we're over 3 million. We've had 30 within Island Health, and I think it's really easy. And I mean, it makes sense that look around. Like I look around, I go outside here in Victoria. It's like I don't see COVID. Like I don't see any concerns, and really, there's very little COVID on the island right now because we've collectively done a lot, and vaccines are going up, and so I think it's hard to see something that might not be right in front of our face, but I could tell you from the experiences in Toronto and being over in Fraser during the second wave and seeing, the surge in the long-term care homes again, that's where it's been worse, but also what recently they had with their ICUs were pretty full, and not just full of people with COVID, but the people with COVID pushed them to their capacity, and some of those people were younger. So I mean, I don't think that there's a debate among, medical professionals. And there's certainly some people who might be on, the very small minority of medical professionals about COVID-19 saying that if COVID-19 is real or not. But it sometimes gets presented. And it's interesting what you mentioned before, Roger, as like a 50-50. It's not 50-50. It's I would say the very, very small minority who question the existence or question the concerns with COVID-19. That being said, as well, just very quickly to say that it's it's not like some people will phrase COVID-19 as like it's the worst virus that there's ever been. That it's in terms of how quickly it spreads and how quickly it can kill people. Well, measles can spread a lot easier than COVID-19. And something like Ebola is a heck of a lot more deadly than COVID-19. So it's easy to blow it out of proportion each way, I would say. Yeah, that's just my initial thoughts.
I just want to encourage folks, if you have a question, feel free to chat. I think it'll be easier to follow up your questions. The next question we have, because we're recording this and we're going to share this this Zoom session with people in our community via YouTube, and because they will not see the question, I'm going to read it, okay? So Mike and Cole, the question is this, regarding from Christina Lockmanets from Duncan. She says, could you give us a breakdown of the number of people in 2020 who died of the normal flu versus COVID-19? I understand that every year people died of the flu, but I haven't heard on the media who has died of the normal, regular flu. It is only COVID.
I can tell you that in BC last year, that no one died of influenza. And it's pretty easy. I could see why people would make the connection. It's like, wait. You're trying to tell me that we had people dying of COVID, but the flu went away? Like, how is that possible? And yeah, it's pretty unreal because we always have flu seasons, but last year we essentially did not have a flu season in Canada, in many areas in the world. And the reason for that is because, well, the same precautions that work across the world for COVID-19 also work for influenza. And so basically the world being kind of in lockdown prevented them from being a flu season. And how the flu usually works is that, it circulates seasonally outside of the equator zone. But at the equator, flu is circulating all the time. And what happens is that we try to predict what flu strains we're going to see in Canada every season based on what's circulating in the global south, because it kind of switches over when it comes to our winter, and what's circulating around the equator. But basically, because influenza was stopped from all the measures that were put in place, distancing, basically going into lockdown, flights being canceled, is that we never actually had the flu come over to Canada. And what we actually know about this is that when we look at we've tested, not everyone, that's 100% sure. We never test everyone who has like symptoms to see if they have influenza, but we did test, I think, almost everyone in long-term care and assisted living who was having symptoms. They would be tested for COVID-19, influenza, both A and B, as well as RSV, which is respiratory syncytial virus. It's one that we sometimes vaccinate kids out for if they're higher risk. And we certainly saw COVID. We didn't see any influenza. We didn't see any RSV. And the question about did we have more deaths in last year from respiratory viruses than usual? Well, actually, if we look at Canada as a whole, probably not. And I think I saw a comment about that. For Island Health, which I'm more closest to the ground with Island Health, is that we definitely didn't. I mean, we only had 30 deaths total. That's a very, very small amount of deaths when we look at all of the reasons that would that cause deaths over the year. Like only a very extremely small proportion of deaths within Island Health were caused by COVID-19. But really, the reason for that isn't because COVID-19 is dangerous. It's because of all the measures that were put in place, really, to prevent these massive breakouts in long-term care and among the most vulnerable and elderly. And if those measures weren't put in place, yeah, I think that we would have seen a lot more deaths. Long answer, but I think it's a complicated question.
Thank you, Doctor. I appreciate that. What advice would you guys give considering traveling plans, mostly precautions that person should take, especially now in summer, either traveling to Ontario or any other areas in Canada? What should a person do?
I think the recommendation for traveling outside of our province isn't going to come into play until around stage 3, which we're expecting around July 1st. But when we're at that position, I think we just need to be cautious and move forward with a lot of the precautions that we're already moving forward with. So, when we go to airports, we're looking at distancing, we're looking at masks as a recommendation, I think, at that point, past July 1st. Good hand hygiene, stay home if you're sick, don't travel definitely if you're sick, those kind of things. And then once we get to that stage, we're going to update our guidelines most likely on precautions to take as we move through the airports and traveling on airplanes. So I think that the key is really stick to what we've been doing for those very basic and simple precautions, distancing and staying home if we're sick, monitoring our symptoms. A lot of the recommendations out there are going to be get your vaccine, because that's one of the main steps in preventing COVID-19 that's being promoted right now. So
thank you, Cole. Our next question is going to come from those people who have their hands up. I think we need to interchange a little bit between the chat and those who really want to verbalize their questions. So it's coming, I believe. The first one was the iPhone that is asking the question here.
Hi.
So please go ahead.
So this is Miriam. And so just give me 30 seconds. I just want to share my position. So first of all, thank you, gentlemen. I can't imagine how difficult, like public health, all of the different decisions that you guys have to make, all of the unfolding of things, and you're trying to protect the public. This community that's online with you right now, I know a lot of these people, and they're all, very pro-vaccine. I'm somebody that is very, very, I'm feeling a lot of caution and very wary of this new mRNA mRNA vaccine and the speed in which it's rolled out, the trials that didn't include pregnant women and children, and all of a sudden we're saying, let's just go for it, all of that. But I just wanted to, just for 30 seconds, just sort of express what I think should be helpful in terms of where families, parents, like where our concerns lie. Because I would really love, maybe even not today, but like for Island Health to be addressing these concerns, because I know that they're shared. I've been on forums, I've chatted with families and stuff like that. So if you just give me 30 seconds, I just want to say that to start, the lockdowns have been very complex, right? There are lots of statistics emerging around the world saying that they don't work because of the lockdowns. There are a lot of people that haven't gotten the medical attention that they've needed. And there's also been some really complicated things because it feels like medical health has been aligning with politics. And that's felt very like it's just pushed the skepticism even further. So for example, even social distancing was a thing, but then masks came and now we're social distancing and we're using masks. If you look up PPE and how masks work, I mean, everybody I know is re-wearing their masks, touching their faces and doing all of these things and not washing their hands. People walk right by the sanitizers. I go into Costco and I'm elbow to elbow with 1,000 people. I go into a local business and I have to wait outside in a line in order to get in. And then the same system is telling me that this is all good, this is all okay. And then each province is completely different. And then the numbers seem really skewed because people have been listed as having died of COVID, even though they had heart disease and all of these different things. I know people that were in the lineups to get tested and they didn't make it through. And then they got an email the next day saying, you've tested positive for COVID, isolate at home. And the thing that's been really concerning for me is that we haven't really pushed treatments. And I've seen around the world, especially in Italy, I'm Italian, so I've been following all of the things unfolding in Italy because I have family there. And there's a network of doctors that say early intervention with like already tried, tested and true and proven medicines like ivermectin and I can never say that right. You know what I'm talking about? Early interventions, but our BC medical system says, no, we don't use those, and isolate at home for 14 days, which is not early intervention. So all of these treatments seem to be missing. And then all of these people are slipping through the cracks. And now the government is being influenced what seems like big pharma saying, hey, we've got this flashy brand new vaccine that's barely been tested, and we want to put it in your children, even though we haven't tested it on children. We have no data practically, and it's safe. And it feels like coercion, like our lives, if we don't want to take the vaccine this year, maybe next year or something, when we get some more information, like our lives are going to be really difficult. And our kids' consent is being taken away from us. And honestly, that just like, you guys seem like really nice guys. And I really like everything you said, Dr. Mike, there about your own personal position. But as a family, like watching all of this unfold, I'm freaking out, right? Like, and we're all freaking out. And it seems like that's not being addressed. Thank you for listening.
I don't know if I can answer it, but I'll like have the discussion about it. Thank you for raising that, Miriam. And there's a couple things to unpack there. The one overall thing I wanted to say is that, yeah, absolutely. I mean, it's been unfortunate in a way, but also kind of not unexpected about how, you know, we have a system in Canada where we have each province and territory doing their own things in a way. That we do have federal agencies, we have the National Advisory Committee on Immunization, we got Health Canada that do provide some guidance, but ultimately it is up to the provinces to decide what the actual, you know, recommendations and measures are going to be, and absolutely, that those end up becoming a combination of, okay, here's what like public health recommends and requires, and then in combination with what the government is recommending and requiring, and often those things are pretty much are going to come out as the same. And so your point is well taken that may not instill great faith in people when they're seeing different measures being taken in different jurisdictions in Canada. One thing that was interesting to me working out in Ontario and Toronto is that it's even a little bit more fragmented, because the public health units there work a bit differently, where, you know, in BC, we have each of our health authorities, Island Health, Interior, Fraser, Vancouver Coastal, the Northern, that we do sort of work together as one, with some ability to do our own little things on a regional level, but a lot of we're going on a provincial level. We're out in Ontario, it's very much like the local public health unit, like they decide how they're going to do things. So Toronto Public Health decides what they're going to do for Toronto. Let's see, like Ottawa Public Health decides what we're going to do from Ottawa. So you can even have in Ontario, for example, more kind of changes as you're driving across the Great Lakes. And so, yeah, I think that the reason that that's unfortunate, because absolutely it doesn't instill necessarily strong confidence in people, that I could see people being like, hey, do they even know what they're doing? There's so many different things. But I think the reason for it is because there's so many different ways to try to get to the same goal. And when we're all in this together, learning together, and new stuff's coming up every day, some people are going to move in this direction a little bit, some people are going to move a bit this direction. And that's just kind of what I see as the reason for it. I'm not trying to, you know, justify it, just trying to explain it from my vantage point. When it comes to treatments, I do think that, you know, when it comes to ivermectin and hydroxychloroquine, that there is a lot of research, of course, being done around the world about this. I have to, you know, default to the BC Centre for Disease Control. They have clinicians who are always reviewing the evidence to see what the best evidence is. And right now their conclusion is that there's not, for ivermectin, it's that there's not the evidence that there's actually benefit for it. That's their conclusion. And then for hydroxychloroquine, there's actually evidence that the risk is higher than the benefit because of the cardiac concerns with that. In terms of other treatments, I mean, we are definitely providing, let's say, dexamethasone when people are hospitalized, because there's good evidence about using dexamethasone when people have severe COVID. And it's just kind of weighing those risks and benefits. In regards to the vaccine being a brand new vaccine, yeah, absolutely. It's a brand new vaccine with a new technology. It has gone through the tip. Sorry?
Sorry, it is a technology. I didn't realize I was unmuted. Sorry.
Yeah, no. Yeah, brand new. It's a brand new vaccine, brand new type of technology. We haven't used mRNA-based vaccines before. It's one that it's gone through the same process that we do with all vaccines. When we start with the tests in the laboratory, just on tissue culture, then we go to animal testing, and then we go to human testing, and there's 4 different phases of that. One is we start in, well, not we, the people who make the vaccines, start in a small group of people just to see if the vaccine, what the safety profile is, if they're going to have bad reactions to that. Then it goes to a bigger group of people to see what type of immune response they have to it, and to see if it actually is effective at decreasing infections. And then the third is that they do another study with a larger group of people to see what the actual optimal timing is of providing the vaccine and the optimal dose. Then they apply to the regulatory bodies. In this case, it would be Health Canada. Down in the States, it's the FDA. And then they decide if they want to approve it or not based on the amount that they had. So that's what was done for all the COVID-19 vaccines. There's one last important phase for every vaccine and every basically product that's out there on the medical market, and that's after the vaccine's already approved, then it goes into post-marketing surveillance. So that's why we actually monitor it to see if there's more rare side effects that are popping up that we didn't actually see in the studies. And that's what happened with AstraZeneca with the blood clots, is that it was seen as, all right, this is rare, where we didn't actually see it in the studies, but it's something that's actually real and associated with the vaccine. And that's why there were changes with how it was used across Canada. And the reason why in kids, it initially wasn't approved in kids is because it wasn't tested in kids. The reason why Pfizer's now been approved in kids is because there's been studies that have been done in kids with people who are pregnant, people who are breastfeeding. Unfortunately, very, very rarely for many medications or vaccines are they actually included in the initial trials. And then it often is left that way, that it's all right, we have to use what we think is the best approach in terms of going with the benefit and the risks for those groups. In terms of kids having the consent taken away, there is the consent process for kids. It remains as we've always done with vaccines and medical therapy is, it's either parental consent or there's mature minor consent. If there's a minor who is deemed capable of making a decision, and this goes with all medical therapy, then they can choose for themselves if they're going to have that therapy or not. So that's a lot. I think we're probably not going to come to a consensus on everything, and I see some other comments in the chat box, but I'll hand it back.
Yeah, thank you. Our next question, and we're trying our best to answer all your questions, both from chat and some of you raised your hands. So we're going to interchange between chat and those of you who raised your hands. And we have someone here by the name of Caroline Lennox. Caroline, please feel free to ask your question.
Hi, thank you. It's hard to just put all of my questions into one. I respectfully thank you for everything you're doing. I know you're doing everything you believe is right. Personally, I'm not a vaccine candidate. I can't wear a mask. I've gone a year without giving anybody anything or catching anything. I'm resentful that we're being told we can't open until there's 3 conditions: 70% vaccination plus testing, test with fewer tests cases, plus fewer hospitalizations. And one of my biggest concerns, and maybe somebody here, it doesn't have to be the medical people, but is there is money being spent, $65 million in Canada, to not-for-profits, which would include churches and medical clinics, to promote vaccine confidence. And I really feel that when churches hold meetings, and not just this one, but any, there should be full disclosure upfront of any and all monies, past, present, and future, related to encouraging vaccine confidence. And if that's happening tonight, that there has been any money flowing, it would be much appreciated to have that honestly put forward. And I'm not accusing anybody, but my one question, other than the money part, is why are we being held hostage to a 70% vaccination rate? If the deaths go down, hospitalizations go down, the cases go down, why would vaccination be held over our heads like that? Sorry, I don't mean to be rude, but I'm very frustrated by it. So I'm trying to be respectful. Thank you.
Thank you for your question, Caroline. And definitely, I just want to say it right from the beginning that yes, as churches, both of Victoria and Rest Haven, our goal of this meeting was to provide a service for the communities that we pastor, and we pastor, 2 churches that cover the Southern Island, which is Victoria and Sydney with Pastor Roger. And of course, our goal is to simply provide this opportunity for people to ask questions. There's absolutely no money involved. We are here not to particularly promote any view. We are here to promote a communication. And I think that's why you are free to ask whatever question you have. And I want to thank, I've never met Mike before, Cole, but I want to thank that definitely one of our church members came up with this idea to engage our health authorities. We didn't even think that you guys will even say yes. I was actually surprised that you, Mike, and Cole actually said yes, because you know what? It's not an easy meeting to take questions like this, because you have no idea what questions people are going to ask. So absolutely, we are here simply to facilitate discussion, to facilitate, I believe also some kind of maybe misunderstanding, and hopefully we will educate ourselves and get to know our health authorities, because what you watch on television or what you read on the internet, but here you have faces of people who are leading health, BC Health here on the island. So, and I can definitely tell you up front that, and thank you, Caroline, for your for your question. Actually, I love your question, because I know in the world of 2021, many people have many strings attached to different organizations, and definitely we here want to be as neutral as possible, simply have a dialogue.
My conflict of interest would be that, like, I'm not paid. I received no money by pharma, but I'm definitely paid by Island Health, which ultimately receives their funds from the province of BC. But I mean, I come to this as a medical health officer, which is an independent physician who has a order in council with the government, where I'm able to speak freely about my medical opinions and my medical expertise. Cole, I don't think that anyone pays you other than the health authority as well.
That's correct. Just Island Health.
Yeah, and then the second part about the restart plan in BC, and that you're right, Carolyn, that there is the one of the indicators that's being looked at is what the coverage rate of vaccinations are. The first thing I want to say is that, like, no one's going to be held hostage. We absolutely 100% are going to get to 70% very soon. We are already at about 66% of people over the age of 18 on the island who have been provided a dose of vaccine. And I think that's pretty consistent in the province of BC. And so one of those indicators is 70% of adults receiving a dose of vaccine. So we're going to get there, and it doesn't require, it's not going to, we'll get there a lot earlier than what those actually, those thresholds are that were set by Dr. Henry. So it's not going to require people who are against vaccination having to get a vaccine before we move into that. And the reason why that threshold was set is because with all vaccines and with all vaccine preventable diseases like measles, mumps, rubella, not tetanus because that's different, but whooping cough, for example, is that if there is if you have high coverage of vaccination or immunity among a population, you can keep on introducing that virus back in or that bacteria back in, but it shouldn't create an outbreak. But if you have a low rate of coverage and you introduce that virus back in, then there can be outbreaks. It's sometimes called herd immunity. I don't want to get too deep into herd immunity because there's a lot of caveats that go with it. But 70% is kind of thought of as like, that would be a good level to get at, where we could probably safely remove all those barriers and not have big outbreaks of COVID occur. So that's where it came from. But we'll get there very soon.
Very good. Thank you. I appreciate that. The next question on the chat. It's actually an interesting question for us as churches. So let's assume that in about a month or in 2 months, the churches reopen. Now we have a group of people that will come in. They have been vaccinated. We have another group of people that has chosen not to be vaccinated. How do interconnect with each other? I mean, are there any precautions, any concerns that we need to have? How do we relate to each other? I mean, do we just go about our, the way we used to do church before? Are there any instructions there that you can give us so we know, what to do?
I don't think there's going to be a time when we are going to identify each other as either vaccinated or unvaccinated. So I think as we are reducing our restrictions and moving back to our way of normal or new normal, however that looks, I think we're going to do that together. So there's not going to be, I see, segregation or cohorts staying at home for those individuals. I don't see that as coming into effect. I think as we move forward slowly, there are going to be guidelines, and we're going to have to move forward with those. And some of the same things that we've been doing with around distancing and staying home if we're sick are still going to be with us for the next 3 months or so. But I don't see moving into the future that we're going to be segregating one another, identifying individuals as either vaccinated or unvaccinated. So I don't see it as being an issue. I see us as a society moving back to normal, not different groups moving in different stages. Mike, do you want to jump in there? Anything else?
Yeah, I agree, and I think of it like measles, where we have really high coverage rates of for the measles vaccine. And so in a group of people right now, and we have no active outbreaks of measles. So in a group of people, it doesn't really matter if you're vaccinated against measles or not, because there's no measles in that group. And that's what really we're looking at, we're hoping to get to with COVID-19, is that the coverage rate for vaccine is so high that, and the amount of COVID going out there is so low that it ultimately doesn't matter in a group if there's a bunch of people who are unvaccinated, that everyone will be safe and not being able to get infected with COVID, because we'll have such high coverage rates. And yeah, absolutely. And I do think that, as you started this meeting about just how divisive some things about COVID-19 have been, and how it really, there's factions that have developed, and I really hope that there's a lot of healing that has to happen after this, and people coming together and understanding of where people are at, and understanding that everyone can make their own choice with this. And so I hope that I look to myself to grant that of people, and I hope that people will grant that of me as well.
Joan has made several comments here with lengthy kind of paragraphs, and I would like to very quickly read through them. And the first one is about the shedding of this something I've heard of myself. She says, I'm wondering about the shedding, transferring that is occurring after people have received the COVID injection. There are many women and possible men who have not received the COVID injection, but are now becoming sick with blood clots and miscarriages for women, to name a couple of incidents occurring because they have been around injected people. What can you say on that subject? And there's a few more questions, but I think maybe let's just start with that one. Mike, what do you have to say on this?
Yeah, I would say that there's really, as far as I've seen and heard and know, no truth behind that. And the reason for it is because we sometimes do see vaccines that can actually go from person to person. One of the examples of that is the oral polio vaccine that is still being used actually to try to eradicate polio. We don't provide it in Canada anymore, because we provide the polio vaccine by injection. But in some countries, it's still being used, and it's a live vaccine. So it actually contains a virus that is live. And so people can pass that vaccine from person to person. And that's actually beneficial in some communities where they have like polio outbreaks, that you can provide one person a polio vaccine and that can be transferred to another person. That can't happen with the COVID-19 vaccine because it doesn't contain a live virus. There's no part of it that can be shed to another person. People are not infected with COVID-19 after receiving any of the COVID-19 vaccines. And the comment about blood clots is that there certainly is. Here's what happens, that final step I was saying before about once a vaccine's on the market, or any medications on the market, the whole post-market surveillance, where they keep on looking to see if there's any rare side effects that happen, is that there absolutely 100% will always be bad things that happen to a group of people after vaccines are provided. And then what really needs to be looked at is, okay, is that due to the vaccine or not? Because we know people are going to die after they get the vaccine. If we're trying to vaccinate everyone on the island, then there's going to be, just by statistical coincidence, a certain number of people who are going to die after getting the vaccine. There's going to be a certain number of people who get hit by a car after getting the vaccine. There's going to be a certain number of people who get, and you can go on, get a new diagnosis of diabetes, get a blood clot. But really what we look at the island health level, at the provincial level, at the federal level, at the international level, if those things are occurring more than we expected. And that's what we've seen with AstraZeneca and blood clots, is that, hey, this is occurring more than we would expect for just the number of people who've been provided a vaccine for this amount of time. And that's the signal that then gets, it works its way up, and then new decisions are made about how to use that vaccine. And so I can't remember about shedding. So I don't think that is is possible from a medical perspective from a vaccine that's not live.
I just wanted to go back. I'm not sure if it was Mike or Cole, but initially you said we're not being required yet to have the COVID vaccine. Were you, I just went, that was your use.
Yeah, you're right. And that was unintentional. I think Dr. Henry has made it very clear many times that there's no vaccine that we actually force people to have in BC, and we have no anticipation that it's going to happen for COVID-19. So sorry, thank you. I appreciate the clarification.
Well, I just wanted you to clarify that because I haven't gotten that impression at work. But certainly what I do at work is I phone the community in preparation for treatments and OR. And I'm getting the same impression that you have given, that COVID is very low on the island, extremely low. They're either lying to me, but they don't come across as lying. I just get the distinct impression that we are not experiencing the same thing that you were experiencing in Toronto, which is great, really. I thought maybe everybody would like to know that, and hopefully that's not confidential information. But anyway, thank you.
Bonnie raised her hand. She had her hand up for quite some time. Bonnie, would you be kind and express and share your question with us?
Hello, and it's very nice that you have organized this, Roger and Marion. It's very professional what you've done, and I really admire you and the people that are helping us here with the answers. I just wondered if this study published in the National Library of Medicine in 2014, talking about super paramagnetic nanoparticles that are successfully delivered into the body via vaccines. And once in the body, they can be used to inject DNA into cells, altering their genetics. The study is entitled Super Paramagnetic Nanoparticle Delivery of DNA Vaccine. That's all I know. And I don't know if you can comment on it or not. I haven't seen the study myself. I'm an RN. I don't mind reading these things, but I like to have your professional opinions about this.
Yeah, I can touch on that. And thanks, Bonnie. The way the mRNA-based vaccines work, so Pfizer and Moderna, the most common ones we have on the island, is that it is a chunk of nucleic acid or genetic material that is injected into the body. And what it does is it goes into the body, and our cells take that piece of genetic material and they translate it into a protein. Then that protein goes through our body, and then we create antibodies against it. To comparison, for the hepatitis B vaccine, what's done is that it's just the protein itself is injected into a person's body, and that's used to create the antibodies. There's one of the benefits of it being this mRNA-based technology is that it takes a lot to actually produce proteins of viruses. You know, for flu shots, we have to it requires this whole elaborate creation of flu vaccines in chicken eggs, and it takes months to do it in advance. Whereas in this mRNA-based vaccine, the advantage is you just take that little piece of nucleic acid, you can amplify it up, and then you have all your vaccines. So that's one of the benefits. What happens, however, is that after that nucleic acid or it's not technically DNA, but it's pretty much the same as DNA. It's still genetic material. When it goes into the body, it's rapidly broken apart, and same with the proteins that are produced afterwards. Those go apart as well. So those don't last in the body, and there's no way for it to be reintegrated into the genome, that it can't stay within your genome or alter your GMO. It's not gene editing therapy. The paper, what I think that you're referring to that I looked up, is more so just trying to get this to technology that would use DNA to edit your genes. And one of the reasons for that and why people are looking into it is because we know that a lot of cancers are actually related to issues with genes, whether or not that there's, for example, breast cancer, there's the BRCA gene that some people can have certain versions of that gene that could put them at a higher risk of cancer. And so the paper you're looking at is actually about, is there a way, and people are looking at that, to introduce a DNA into someone's body so that it can actually take away the bad genes. Now, there's no way to do that right now. The mRNA-based vaccines are not a way to do that. These are things that are being studied in animals, and maybe in the future this would be a way to actually prevent some cancers, but it's totally different than COVID-19 vaccine at the moment.
The next question, and guys, I'm excited that the chat is full of questions and comments. At the same time, I'm going to have to tell you the bad news is that we will not cover all of them. I apologize for that. We have about 1 minute left based on Dr. Mike's availability, so we'll not be able to accommodate all of them. But I'm just going to ask, at least from my end, this last question here in the chat. It's from Anne. Does the vaccination prevent the virus or its transmission, or is really a vaccination then? So that's the question.
Before the COVID-19 vaccines came about, I don't think there was as much scrutiny into vaccines and about how effective they are. And I think that many people I talked to sort of thought, and understandably, that it was, if you don't have the vaccine, you can get the disease. If you have the vaccine, you can't. But there's no vaccine, as well as there's no medical treatment or really anything in this world except, what's the expression, death and taxes. That is 100%. And so with the measles vaccine, let's say, really super effective, but there are definitely people who can get measles after having 2 measles shots. The reason for that is there's some people who will not respond, who will, despite getting the vaccine, they will not actually develop enough antibodies to be immune. What we're seeing with the Pfizer Moderna vaccines is that it is very effective. It's about as effective as we can expect for a vaccine at about 95%. And what it does, so it's very effective at decreasing someone's risk of getting COVID. And if someone was to get COVID and they're vaccinated, very effective at decreasing the risk of you passing it on to someone else, because it decreases the duration you'd be shedding virus and the amount of virus you would shed. And it also really decreases almost to 0 the chance that you would get really sick from COVID or die from COVID. But that being said, there are going to be people who end up getting COVID after vaccination, just like there's people who end up getting whooping cough after being vaccinated for whooping cough and measles after getting measles shots. Nothing's 100%. Wish it was, but it's pretty close.
Yeah, thank you. Thank you, Dr. Mike, and thank you, Cole, Diplock. We really, as I said, I did not even think you guys would have time or even desire to come and address the public. I really want to thank you on behalf of the communities here in Victoria, Rest Haven, Sydney, Duncan, Souk, and you know what? This presentation, this exchange informative session will be also posted on YouTube. So, folks, please check out our YouTube channel, which is Church in Victoria. And Pastor Roger, what is the channel on YouTube that you have? It's Church in Sydney, right?
That's right.
So very easy, folks. If you go to YouTube, just click on Church in Victoria. You can click the likes. And trust me, on that channel, you will find many other topics that we cover, including Bible studies and sermons, and of course, even subjects on COVID-19. We really appreciate Dr. Mike and Cole. And all I have to say on behalf of all of us, thank you. Thank you. It's kind of easier for me now to see faces, because, when you hear the information and don't see the faces, and, and I'm actually quite amazed. You guys are young. You're young and full of energy, and the fact that you came and addressed the many questions, and I'm sure that your job to cover the whole island is tremendous, to address all the things and all the questions and all the challenges. We want to thank you, and we will be praying for you. God bless you. And since we also have an element of faith, Mike, something that we believe science does not contradict. We also found some research that people who have faith and who pray, they also have sometimes better recovery, better health. So that's why hospitals have chaplains. And so if you don't mind, we're going to have just a closing prayer. I want to pray for you. Is that okay? I want to ask the Lord's blessing on you. And Pastor Roger, would you be kind again to offer this closing prayer?
Gracious Father, we thank you once again for guiding this event, for being with us. I know there's a lot more questions that can be asked, and we pray, Father, that you may guide us to find the answer to those questions. I know that we probably would like to make more comments, and unfortunately, we're limited by time. But we thank you for the availability that Mike and Cole show to be with us. And Father, right now I want to pray specifically for them. I ask, Lord, that you may bless them. It is a big task that they have on their shoulders, and I pray, Father, that you may guide them, help them make the right decisions, help them know what to do, and surround them with the right people that can also help them in accomplishing their tasks. I pray, Father, that you may continue to protect them, as possibly they also visit locations that might have patients and might have, seen effects of COVID or other disease. I pray that you may protect them, protect their families as well, Father. Bless them in any way they need. And Lord, just with all of us here today, I just pray that you may continue to keep us safe, to protect us, and to bless us. In Jesus' name we pray. Amen.